Good evening and welcome. My name is Walt Williams. I am the newly elected president of the Edwardsville NAACP. The number of people online for this town hall forum reminds me of the importance of this topic is in the African American community. African Americans on a national level have shown a hesitancy towards the coronavirus vaccine. Needless to say, the longer our communities delay in getting these vaccines, the longer the road to recovery. The coronavirus has negatively impacted our communities of color more so than any other communities nationally. This town hall is an attempt to address your issues and concerns related to the coronavirus vaccine. Before I introduce the moderator for tonight's event, allow me to say thank you to Karen Parker Davis, Tracy Daniels, Sharman Aaron. Their work and contribution make this town hall possible. Thank you. The moderator for this event will be Catherine Carter. Catherine is a native of Chicago, Illinois, and is currently an anatomy professor and cancer research assistant. She has served as mistress of ceremonies at several events, and she produced and hosted her first inspirational jazz concert in 2004. Catherine has over 15 years experience in radio broadcasting, marketing, and production. She has had the opportunity to express her unique radio announcing and DJ flavor at KWWJ Gospel 1360 AM in Houston, Texas, WYCA Rejoice 102.3 in Hammond, Indiana, KABF 88.3 FM, The Voice of the People in Little Rock, Arkansas, and KUAP 88.3 Pine Bluff, Arkansas. Catherine is the producer and host of a new and thriving show, Friday Night Live, which is a positive platform that strives to form an encouragement for her viewers, as well as spotlights artists and business owners in our communities. I'll now leave you in the capable hands of Ms. Catherine Carter. Ms. Carter?
Can you guys unmute Catherine?
Ms. Cunningham, can you unmute Catherine?
Thank you, NAACP. This is an honor, and I am humbled to be part of this panel as we try to give good information out there for people about the COVID vaccine. Let's start off with, please, I need everybody to turn off their videos and mute yourselves so that our bandwidth will be at a good consistency so that we can have a good broadcast. The information in this presentation is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained in or available through this presentation is for general information purposes only. The presenters and the NAACP make no representation and assume no responsibility for the accuracy of information contained in or available through this presentation. You are encouraged to confirm any information obtained from or through this presentation with other sources and review all information regarding any medical condition or treatment with your physician. Never disregard professional medical advice or delay seeking medical treatment because of something you have heard, read, or viewed in this presentation. The presenters and the NAACP do not recommend, endorse, or make any representation about the efficacy, appropriation, or suitability of any specific tests, products, procedures, treatment, services, opinions, healthcare providers, or other information that may be contained in or available through this presentation. The presenters and the NAACP are not responsible nor liable for any advice, course of treatment, diagnosis, or other outcomes for anyone who watched, listened to, or participated in this presentation. I would like to introduce to you our amazing distinguished panel. First, we have Dr. Ronald Rember Jr. He is a family physician with over 10 years of experience practicing medicine with a focus on treating the underserved with acute and chronic illnesses. He is a trustee with the American Association of Public Health Physicians, fellow of the American Academy of Family Physicians, member of a National Medical Association, assistant clinical professor in the Department of Family Medicine, co-chair of the Community Advisory Review Council reviewing community medicine research projects and the University of Chicago, and he's an instructor to medical students at Rush Medical Center. He currently works as a physician advisor and clinical liaison to hospitals around the country with RI, managing a team of physicians around the United States. Dr. Rembert received his medical degree from the Chicago Medical School at Rosalind Franklin University of Medicine and Science in Chicago. He completed residency at Rush Medical Center and at Advocate Illinois Masonic and served as chief resident during his last year of residency. He is married to his beautiful wife, Gaynell, and they have 2 wonderful children. Please welcome Dr. Ronald Rembert Jr.
Good evening, everybody. How are you? And thank you for joining us.
Tony Corona. Tony Corona has been the public health director of the Madison County Health Director since 2003, July 2003. She holds a Bachelor of Science in Environmental Health from Illinois State University and is licensed in the state of Illinois as an environmental health practitioner. She is currently president of the Illinois Public Health Association. She was born and raised in Alton, Illinois. She's an active member of Zonta Club of Alton and Wood River and is on the board of directors of the Behavioral Health Alternatives Mental Health Agency operating in Wood River, Illinois. She has some achievements, some really nice awards. Alton YMCA Women of Distinction Award in 2012, Centerstone Community Champion of Behavioral Health 2018, and in 2019, Illinois Triad Kathleen Quinn Award. Please welcome Tony Corona. Say hi, Tony.
Good evening, everyone. Thanks for inviting me.
Dr. Carl Earl Lambert Jr. Dr. Carl Earl Lambert Jr. was born and raised in Calumet Park, Illinois. He received his high school diploma from the Illinois Mathematics and Science Academy in 2003, his bachelor's degree in biology 2007 from Washington University in St. Louis, his MD from Rush University Medical College in 2011, and completed his residency at West Southern Medical Center Family Medical Residency Program 2014. He is an assistant professor of family medicine at Rush University Medical Center and is involved with academic medicine as well as mentorship, recruitment, and retention of minority students in medicine and making Christ known in his everyday life through whatever situations the Lord chooses. He enjoys providing thorough, compassionate, and wholesome continuity and preventative care to people from all communities and walks of life as medical director of Rush University Family Physicians Group. Dr. Lambert remains very involved in the Rush community in several capacities, including clinical, educator, and preceptor, the director of the Rush Family Medicine Leadership Program, director of the Service Learning Curriculum, and active member of the Admissions Executive Committee, a faculty advisor for minority medical students in the Student National Medical Association. And Dr. Lambert is a member of the American Association of Family Physicians. He's also a diplomat of the American Board of Family Medicine, member of the Christian Community Health Fellowship, academic advisor for the National Medical Fellowship, Minority Primary Care Leadership Program, and the Chicago area Albert Schweitzer Fellowship Program. Dr. Lambert has been fortunate to be the recipient of several awards in his career: the 2011 David Jones Peck MD Award, 2011 National Medical Fellowship Resident Scholar Award, 2017 recipient of the Outstanding Educator Award for the Office of Congressman Danny Davis, 2017 recipient of the Leonidas J. Berry MD Award for Diversity and Inclusion, 2017-2018 Family Medical Preceptor of the Year Award, 2017-2018 recipient of the Rush Medical College Positive Learning Environment Award, and the 2020 Illinois Academy of Family Physicians Teacher of the Year. He is happily married to his lovely wife, Adrienne, and remains engaged in his home church, Bellevue Baptist Church in Chicago, Illinois. Please welcome Dr. Carl Lambert, Jr.
Whew. Whew, I'm doing this too. Good evening. It's a pleasure to be with you all this evening.
Finally, Dr. Rodney Alford. He is a board certified pediatrician and internal medicine specialist that has practiced medicine for over 35 years. He is a graduate of Loyola University of Chicago's undergraduate and medical schools. He completed residencies in both internal medicine and pediatrics at Cook County Hospital in Chicago. He later earned his master's degree in business administration at Olivet University. In addition to maintaining and managing 3 medical offices with his physician partners, he has served as medical director to an inpatient drug rehabilitation facility, a state prison for adolescent youth, a laser medical spa, and a group home for mentally challenged men. Presently, he practices in a rural community of Central Illinois and serves as the medical director of a local hospice company, as well as medical director of the local prison. He serves as one of the 5 trustees representing 11 counties in Illinois for the Illinois State Medical Society, and as an alternative delegate, he represents Illinois for the American Medical Association as well. He has received many local, state, national awards, and as a practicing physician, including the Damien Humanitarian Award of Loyola University, the Rural Health Practitioner of the Year Award for both 2000 and 2001, Push Excel Above and Beyond Award presented by Reverend Jesse Jackson, 2003. In addition to his private practice with 3 office locations, he started 2 school-based clinics in Kankakee County, Illinois in 1986 that not only still operated in his absence, but served as examples for school-based clinics throughout Illinois. Through his foreign missionary work, he has helped to establish multiple medical clinics in the poorest regions of Nigeria, Haiti, and Jamaica. In 1986, Dr. Alford was elected by the American Medical Association and the American Hospital Association as one of the 50 most positive doctors of America. In 2003, he became one of 56 National Thomas Jefferson Award recipients by the American Institute for Public Service. He also received the highest award for public service given to a United States citizen, the Jacqueline Kennedy Onassis Award. Kankakee County, Illinois, named October 23rd, 2003, Dr. Rodney S. Alford Day. Please welcome Dr. Rodney Alford.
Thank you. I'm really grateful to have this opportunity to speak to you tonight. Thank you very much.
Okay, so we're going to start with our COVID-19 questions. I'm going to ask each doctor a series of questions, as well as Miss Tony Corona. And then after the doctor finishes his answer, I'm going to open it up if any of the other doctors, or if Tony, if you all have any other comments. The first question is for Dr. Ronald Rembert. What are my chances of having a severe allergic reaction?
Once you receive the vaccine, typically that's rare, but there have been a few cases after people receive the vaccine where they had an allergic reaction. And typically those are people who are allergic to some of the components in the vaccine, including, if I'm not mistaken, polyethylene glycol, which is a component I think that's contained in the Moderna and Pfizer vaccines. But typically it's rare that someone would have a severe allergic reaction after receiving these vaccines.
Would anybody else like to comment?
Sure, I can come and add to that. Dr. Rember said everything that needs to be said, but I like to break it down even more. Right now, if you look at the Moderna vaccine, there have been only 2.1 per million significant allergic reactions from the Moderna, and only 6.2 per million with the Pfizer vaccine. So you can understand by hearing that it's very unlikely to get a severe allergic reaction from these vaccines.
Okay, thank you. The next question is for Dr. Lambert. How can I safely receive the COVID vaccine if I've had allergic reactions to other vaccines?
Yeah, it's a great question. Kind of dovetails from the previous question that's been asked. You know, thankfully, severe allergic reactions are exceedingly rare. And what I've been seeing is that with allergic reactions and when these vaccines are administered, what happens is it's done in a very measured way where patients go. It tends to be a very staggered fashion where you're monitored. So if you do have a history of that, that's something that you should discuss with your primary care doctor first. And if they clear that, then by all means, you should get it. And then again, you're monitored for about 15 to 30 minutes. And then if need be, if there's any symptoms that are really concerning of severe reactions, which would be, you know, your throat closing, swelling, shortness of breath, things of that nature, there's treatment available for that, much like there is for any other, you know, allergic reaction, like if you're allergic to foods or other sort of substances. There's medicines known as epinephrine or an EpiPen that can sometimes be used even if a severe, you know, allergic reaction does occur. So I've told my patients and counseled them that, you know, fear not. It's in most cases, it's totally safe for you to consider this vaccine. And also there's ways to mitigate if there's a severe allergic reaction, or even if there's just milder side effects that I'm sure we're going to talk about later, like fever, local soreness, fatigue, just feeling, you know, just crummy or having generalized malaise from it.
Thank you, Dr. Lambert. Would anybody else like to comment?
Well, if I could just add to that, representing local health departments on this call this evening, you know, the majority of the health departments are establishing these vaccination clinics. And please know that those critical components are absolutely planned for, and you know, we have I think very meticulous guidance and planning that have gone into these clinics to ensure that, for example, if there is that chance of needing the EpiPen, those are on site in the clinics. You know, we actually have trained medical personnel ready and watching very closely individuals for that 15 to 30-minute time period to ensure that we don't have any immediate negative reactions to the vaccine. So I think the site itself where you're getting the vaccines, you know, I believe that everyone should feel that we have a set of standards that we're all following.
Thank you, Tony. The next question is for Dr. Alford. Is it possible to get the COVID from the vaccine?
Well, that's a good question and a very important question. But no, you really cannot become infected or even infect others from receiving this COVID-19 vaccine, because the vaccine itself contains no live or even dead virus. Basically, it contains a protein, and that protein that's given actually causes your body to understand, or it directs your body to produce a protein that then teaches your body how to fight off the virus. So you're basically teaching your body how to fight the virus without actually giving the virus or giving a dead component of the virus. It's just a protein that you're giving that stimulates the body's antibody system.
Thank you, Dr. Alford. Would anybody else like to comment?
I just agree. I think it's a super important distinction to make. The way that these vaccines are created, it's really slick. It's really cool, if you don't mind me saying that. Because in the past, some vaccines you would actually give a dead version of the virus or a weakened form of it. None of that is present for these types of vaccines that are out, the Pfizer and Moderna. So again, that's something that I reinforce with patients too, to say, hey, this is absolutely safe. It's literally giving your body the blueprint to fight against the virus should you actually come into contact with it. which again lends also to I think the safety of the vaccines themselves.
Thank you, Dr. Lambert. The next question is for Tony. How are the COVID vaccinations prioritized in Madison County?
Well, Madison County, obviously, we're following the state and federal guidelines. So today, actually, phase 1B just started. Prior to 1B, those are, let me specify the persons in 1B are people aged 65 years or older or non-healthcare frontline essential workers. And, you know, kind of keep in mind, those are individuals that, you know, are potentially in occupations where they work very close to one another. They have job skills and such that are imperative that if they're not there, we have concern for the actual critical infrastructure of the areas. They are educators. There's a lot of different groups that are listed in phase 1B. Primarily those individuals aged over 65 as well. In Madison County, we too are on that phase. I'll talk, I guess, a little bit later about our actual vaccination process, but I think what's most important is to realize that we're trying to establish clinics and access to vaccines in a multitude of ways through utilizing different community partners and different locations and ultimately getting into communities, especially communities that we know that there could be a potential for proper access to vaccinations, et cetera. So we're looking and planning for all of those circumstances. The age population of 65 years or older, that's actually well over 50,000 individuals in Madison County that we anticipate. You know, perhaps not everyone wants that, but the way our phones are ringing and emails are ringing and coming in, pretty much I think 50,000 people want that shot right now.
Thank you, Tony. Would anybody like to comment on that? Okay, the next question is going to Dr. Ronald Rembert. Can my children be vaccinated?
Not at this point. The makers of the vaccine, Pfizer, Moderna, are looking at potentially giving the vaccine to those younger than 18. But right now there are ongoing studies that are taking place, including Moderna's study where they're looking at vaccinating children all the way to the age of 12. But at this point, it hasn't been approved for vaccinating children 17 years of age and younger.
Thank you, Dr. Rembert. Would anybody else like to comment? The next question is going to Dr. Lambert. What are the common vaccine side effects?
Sure, it's a great question. I think it's important to bring that up so when patients get those side effects, they're not like, see, I should have never got that vaccine. No, that some of this is to be expected and is part of the immune response. So some of these symptoms is really, it's a sign saying that your body's received the blueprint and it's trying to churn out antibodies and an immune response so that if you ever come into contact to COVID, your body knows what to do. So some of the common things to be aware of would be, you know, fever or elevated temperature, could be certainly local site soreness. So I myself had that side effect after I got both of my shots for COVID. It could be generalized muscle aches. It could be fatigue, headaches, things of that nature. And the other thing that I want to point out is even if you get those things, they tend to be short-lived. So you shouldn't be having these symptoms for a week. So a lot of times it tends to resolve within 1 to 2 days. And then there's also methods to mitigate that too. So if you have any of those symptoms, don't forget that you can use, if there's no contraindications, right? If your doctor said you can't use these medicines, but you know, medicines like Tylenol tend to be super helpful for that, or even just getting adequate rest. I know I've had colleagues who just to be on the safe side, they took the day off after they got the vaccine just to be at home and to recuperate. But even when they did that, they were back to work shortly thereafter. So those are some of the few common side effects that I've seen and also were published in the trials for each of those vaccines.
Thank you, Dr. Lambert. Would anybody else like to comment?
Yeah, I appreciate that from Dr. Lambert. That was very, very important that he mentioned that you expect to have some type of symptom. You may or may not, and just because you don't doesn't mean that the vaccine didn't work. But because you do, you also can say that, well, it is working. So it will work. and it's going to have 95% efficacy in those folks that get it. And those side effects, we have to be very honest with people that they are going to happen, that you're going to have some symptom. We don't call it a side effect. We call it a positive reaction. And that's the way to keep it positive, because we do want to mount a response, an immunologic response. And what that means is that you will have some type of a response to it. You may not even notice what that response is, or you may notice it. And he did a good job of covering some of those different call it responses. There have been a few cases of Bell's palsy. I think there were about 4 in each of the vaccines. Bell's palsy is nothing more than usually a self-limited facial paralysis. It looks terrible and it scares people. And I've seen it shown on the internet. I've seen some people that have had that. And those folks that have are very, very concerned. They've even to the point of telling people, don't get this vaccine because it's going to cause you to have this disfiguring type of problem called Bell's palsy. Well, in the great majority of cases, Bell's palsy resolves itself. And if you think about it, I would much rather have Bell's palsy for a few days, weeks, or even months, as opposed to having death. So it just makes sense to get this vaccine. I really, really encourage and emphasize how important it is to get it. When we know the numbers of people that have gotten the vaccine, somewhere over 20 million people have received it in the US, and we haven't really reported one definite death from that vaccine. So I encourage everyone to get it, whereas we've seen 24 million that we've counted cases of COVID, the virus itself, of people getting the disease. And we're talking about over 400,000, almost 420,000 people that have died from it. So again, the odds of you dying from this vaccine is less than 1 out of 20 million, whereas the chance of dying from the disease is 420,000 out of 24 million. So when you get those kind of numbers, it makes it very simple to make the decision to get the vaccine. That's what I've told all my patients. And after I've given them those simple statistics, they're ready for the vaccine.
Thank you, Dr. Alfred. The next question is for you, Dr. Alfred. When will immunity to COVID-19 develop?
Each individual is different. That's an excellent question, because I've heard that question asked quite frequently. About 2 weeks after you receive the vaccine, either the Moderna or the Pfizer, about 2 weeks after the first dose, you get an immune response. And that immune response may be approximately 50%. That second booster dose, I'm calling it, is the dose that causes you to get an immune response that's about 95% effective. In other words, 2 weeks after the second shot, you are much less likely of getting this disease. And it has 95% effectiveness. You can't beat that with any other vaccine that's out there. So 2 weeks, maybe 3 weeks after that second shot of either of the vaccines, that's when your peak immunity develops.
Thank you, Dr. Alfred. Would anybody else like to comment on that question?
Sure. So one question I keep getting from patients is, say, hey, Dr. Lambert, if I get both of my vaccines, can I kind of do whatever I want to do now? And I would say, no, not quite yet. So even if you get your vaccines, that's awesome, but you still would maintain the proper guidelines. So you would still wear your mask, wash your hands, appropriate social distancing, because we're not fully out of this until we get, what's called herd immunity. So I think we have to achieve, maybe 70 or 80% of the population would have to be immune, as was just described, before we can even have that conversation of when do we fully go back to normal. So I've told patients, even when it's your turn or you decide to do it, remain vigilant about it. Remain vigilant about how you go and how you navigate through the world.
Thank you, Dr. Lambert. The next question is for Tony. Discuss the different phases of vaccinations in Madison County.
Well, again, we follow the guidelines that the state health department is rolling out, and that's obviously based on CDC and additional federal guidance. So the initial phase is what we call phase 1A. That went primarily to healthcare personnel and long-term care facilities. Now, folks are wondering about the progress of the long-term care facilities. That's actually being accomplished. That vaccination process is being accomplished through a federal vaccination program with Walgreens and CVS. So actually most local health departments, including Madison County, we have an assurance role to fill to make sure that, you know, everything is going smooth. But fortunately for us, that very important population is being taken care of, so we can concentrate then on the rest of the population within our county that meet that criteria. The first criteria were healthcare personnel. We anticipate that we had anywhere from 12,000 to 17,000 individuals who are Madison County, who live or work in Madison County, that would meet that criteria for phase 1A. That includes a lot of different looks and faces. That's dentists, that's doctors, that's dental hygienists. It's obviously all the healthcare workers, it's home health workers, you know, et cetera. So it's quite an extensive period to date, because we really have been working on 1A, just to kind of give you some idea of charting our progress, if you will. We've administered, not just Madison County, but in not just the health department, but within the county, we've administered pretty close to 9,700 vaccines. And probably we've completed about 2,300 of 2-dose series. Now, again, that's all of those individuals that received vaccine in that phase 1A category. Today, phase 1B started throughout the state of Illinois. And so we will now be trying to reach people that don't necessarily have a specific role, like a healthcare personnel, but these are individuals who are frontline essential workers, and also individuals aged 65 years or older. It's not even accounting for chronic medical conditions at this point. I think this was something that Illinois actually set out to come out weeks before the federal government changed. You know, initially phase 1B was going to be 75 years and older. And I'm really proud that Illinois dropped it to 65 years and older, because we certainly want to look at the mortality and the incidence rate of the COVID disease. And there's no question that individuals 65 years of age or older are at the greatest risk of getting this disease. So that's where we're really going to concentrate, probably likely for the next several months. Vaccines not rolling out as fast as we'd like it to. However, we're utilizing it as fast as we can to get it in the arms of those individuals. We'll get through 1B, we'll move through 1C, and so on. Hopefully vaccine production will be that will allow that pretty much anyone in Madison County that wants a vaccine, hopefully within the next, you know, I'd give it 3, 4, 5 months, something like that, they'll be able to get their vaccine. That won't be an issue. It's a little tough right this second, because everybody wants it now. But we are working on those allocations and working to be able to provide the vaccine as quickly as possible when we receive it.
Thank you, Tony. Would anybody else like to comment? Next question is going to Dr. Ronald Rembert. Could I still spread the coronavirus to others even if I've been vaccinated?
That's an excellent question, Catherine. It is possible, and you know, as Dr. Lambert and Dr. Alford have mentioned, even after we're vaccinated, we still have to take precautions because these vaccines aren't 100% effective, but they are approximately 95% effective when received in that 2-dose series as prescribed. There is still a small chance that you can either contract the virus or potentially pass it to others. So we still, even after receiving the vaccines, have to be vigilant in being socially distant, washing our hands, wearing masks, doing all the things that need to be done until we get to a point where we can get to what's called herd immunity, where a majority of people have developed antibodies against the virus and can be in relative safety. But for now, no, we still need to be vigilant about even the steps that we take after we receive the vaccination.
Thank you, Dr. Rembert. I want to remind people that have maybe come on a little bit later, please turn your video. If you have your video on, please turn your video off, because I think we have a lot of people and it's causing a little interference with the bandwidth. So please turn your video off. Would anybody else like to comment on this question? Okay, the next question is going to Dr. Lambert. How long will my immunity to the COVID-19 last?
That's a wonderful question. So, and this is kind of where we have to be transparent about what we know and what we don't fully know as a medical community. So this might be, this is an area of research that's still happening, and I'm going to open this up to my co-panelists as well. Thankfully, you know, COVID-19 is not the first coronavirus that's hit the scene. You know, there's your kind of your friendly cold type virus coronavirus, but there's been other ones in the past that have been studied and have had vaccines created against them. So if you look at those previous models, we're hopeful that the immunity would last maybe a year, maybe several months, but we don't fully know. So it could very much be a similar model to how we get a seasonal flu shot, right? And then on top of that, there's also been words in different countries where the coronavirus has mutated and shifted a bit. And there's been questions about, well, how does the vaccine confer to that? Do we still have protection even with these new strains that may be coming out? Or again, will we have to have different seasonal types of vaccines? So we don't fully know the answer to that yet. I know with natural immunity, so if you had coronavirus or you had COVID infection, you know, it's postulated that immunity will last for you about 90 days or so. So even in those populations, it's recommended to get the vaccine after that window period to confer a longer period of immunity. So, you know, you know, we don't quite know, but it seems like it's somewhere between months to maybe a little over a year. But again, I open that up to my co-panelists as well to weigh in.
Would anybody else like to comment?
Excellent question, Catherine. As Dr. Lambert mentioned, there are also some variants of the virus that are being seen in other countries. And there was a recent article published where Moderna is looking at a possible booster after a year after receiving the second dose, with concerns of the variant specifically from South Africa. The British variant that we've seen, the vaccines have been effective against, and antibodies are being produced against it. But for this South African variant that's been seen recently, Moderna is looking at the immune response and stating that they may need to develop a booster to help increase the antibody response that people are producing after receiving the 2 vaccination series.
Thank you, Dr. Rembert. The next question is going to Dr. Alford. Are rumors of female infertility related to the COVID-19 vaccine true?
Good question. I can answer that very simply. No. There are so many rumors out there that people will have regarding the vaccine. There's no evidence that shows that women are becoming more infertile, and we don't have any information that men are having problems as well. Whereas if you get the disease, and again, this is how I talk to my patients, if you get the disease, you do have a chance of becoming infertile. You do have a chance of having some problems with sperm production if you get the disease. There has been nothing to show that either of these vaccines cause any problems with fertility in women or any other problems with men as well. So if you want to protect your fertility, get the shot. Otherwise, get the disease, and then we'll see.
Thank you, Dr. Alford. Would anybody else like to comment?
Sure. Two things kind of came to mind. One I might be forgetting, but I got one at least. So I think it's important to bring this up, that there's so much misinformation. And a lot of times when I speak to my patients, especially Black and Latinx patients, that we understand that there has been a history of experimentation and exploitation to those people groups throughout history. So medicine, we've been complicit in that. You know, you don't have to look back too far in your history books to think of like the Tuskegee experiments and even, you know, original day OB-GYN studies. There is female mutilation of Black women there for the betterment of health, right? So there's been all these sort of misdeeds that have happened in medicine, and that sort of, you know, that the COVID vaccine is experimentation or it's going to hurt our people is just simply not true. And I've been trying to tell patients that this is an opportunity actually to protect ourselves from not just dying from COVID, but also from what was just mentioned. There's a wide array of symptoms that happen to patients that they may not be in the hospital or have to be intubated, but there's a wide array of conditions that are like that happen after the virus that we don't fully understand. So, you know, we have patients that are, you know, they're fatigued for many months, or they just don't quite feel at 100%, or they have mental fogginess and all these other things. So that's what we call long haulers, right? So, you know, that's another thing to think about with getting this vaccine. Not only consider getting it so that you don't die from COVID, but you also can avoid those long-term effects that we don't fully understand. That's another benefit, right? And then I forgot the other thing that came to mind, but it'll probably come up later. I at least wanted to say that piece.
Well, I want to add also, Dr. Lambert, I'm glad you brought up some of the issues about experimentation in the past. Some folks have the misunderstanding that a lot of these experiments, you know, that have been carried out because people wanted to find out the truth about certain types of illnesses. The Tuskegee experiment actually was where they studied Black men. I think it was about 700 of them, 600 or 700 Black men. And they studied them after they got the disease. And they watched to see what would happen to these men. Actually, over 40 years, they observed these men. Back in the 1930s, it started. For 40 years, they watched these men and watched how the disease destroyed them and destroyed their bodies, and never treated them. Of course, penicillin was introduced, and they never gave these men penicillin. And so we need to know that history and know that this wasn't something that was given to these men. These men came with disease, and they were denied treatment. And so now what I tell my patients is that you don't want to be part of the Tuskegee experiment number 2, where you decide on your own to not be treated so that we can now watch what happens to you. You want to be part of the treatment group so that you will actually come out smelling like a rose, as opposed to those folks that decide, I'm not going to get this treatment, I'll just take my chances with COVID. Those folks will be watching them, and we'll watch what happens to them. We do hear about the long hauler syndrome. We don't know how long that long hauler syndrome will go on. We don't know if it will eventually take people out. We don't know that because we haven't had an opportunity to study it long enough. We don't know a lot of things about this because the virus has just been discovered. So we have to be very careful about which part of the experiment we want to be part of. We want to be part of the non-treatment group or part of the treatment group. I choose the treatment group.
Thank you, Dr. Alford. Thank you, Dr. Lambert. The next question is going to Tony. Where will vaccinations be administered?
So that's a great question. In Madison County, we have 5 hospitals in Madison County. Population, as you know, about 263,000 people. So we have really relied upon our hospital partners to assist in administering vaccine. The health department has established at this point 2 sites, kind of large sites, that we will hold routine vaccinations clinic days. We'll have a first dose days and second dose days, if you will. One is at the Gateway Center in Collinsville, and then we're looking at securing and firming up the Commons area at Lewis and Clark Community College. We are in Godfrey, Illinois. We are also partnering with several federally qualified health centers. Southern Illinois Healthcare Center is one of our FQHCs that is helping tremendously with establishing and helping us do some offsite clinics for individuals, for example, that don't have the ability to come to an actual clinic. So these might be, group homes and things like that, where it's actually easier for transportation, et cetera, to go and administer the vaccine to those individuals. In addition, we have a lot of other community partners. Madison County has a medical reserve corps of over 460 individuals. So we are working on currently asking for the nurses and medical and both non-medical people within the Reserve Corps. We're working on recruiting those individuals to help us administer vaccine and work in our clinics so that we can continue to do this. And then, again, we've got a lot of medical providers that will ultimately be able to get the vaccine within their own medical practices to be able to provide vaccine to their patients. The timing of this all is simply we just need a little bit more vaccine to become available to be able to go through all these spots. A big improvement that just happened this week was the state allowed for and has accommodated some of the retail pharmacies to also begin administering vaccinations. So it's starting out very slowly. I know that Walgreens, there's only one Walgreens right now in the city of Edwardsville that has the capability to administer that vaccine, but I anticipate seeing more local pharmacies coming on board to have vaccine. Today, Illinois launched a website, coronavirus.illinois.gov, where they've put a vaccination clinic, vaccine finder on their website. It just started, it just launched, but as again, we continue to come on board with established clinics, that information will be populated on that website as well as our website, madisonchd.org. So individuals will be able to watch all those different avenues to see where vaccine becomes available. We're also working, we'll be launching soon, as soon as we get the vaccine in to schedule the clinics coming through more, we'll be launching an appointment scheduler online through our own website that will allow people that are utilizing our clinics that we're doing to be able to sign up and get the vaccine in the future. And then I'll stop. There's one more thing that we will be doing is be working with particular community leaders in some of our areas where we know we have vulnerabilities and we want to make sure that everyone has access to this vaccine. We'll be working on some smaller community sites within specific municipalities. And we hope to continue to work and discuss that process so that we can have that rolling out in the next couple of weeks as well.
Thank you, Tony. Would anybody like to comment on that question? I would like to get the permission of the panel. I have a few questions in chat that I kind of want to address. Will that be okay?
Sure.
Yeah, that'll be fine.
Okay. The first question, and anybody can answer this, should you take a different vaccine for your second shot if the first kind is not available?
I can go and start that off if it's okay.
Yeah.
I would encourage you to get the vaccine, the first vaccine that's available to you as soon as it's available to you, and then follow up with the second vaccine, either 3 weeks if we're talking about the Pfizer, or 4 weeks if we're talking about the Moderna vaccine. We do not recommend that you take one vaccine one time and then get a second, the second shot being a different vaccine. We don't encourage that. However, if in certain circumstances that the person can't get the other vaccine for whatever reason, and we don't think that reason should come up, then it may still have some effectiveness. The studies that have been done have not been done to show this at all. And so we don't really want to get outside of treating outside of what's been studied. So it's not encouraged to do so.
Would anybody else like to comment on that one? Okay, there's another question in chat. As this vaccine is different in its composition and how it interacts with the body, Should a person with an autoimmune issue be weary? Might it activate a different attack response?
That's a good question. I'll take a stab at it. So I was just talking to a patient the other day who has an autoimmune disorder, and they had reasonable questions. From my knowledge, no, that should not be an issue. Again, just like the biology behind mRNA vaccines is they should not affect how your immune system works in terms of it should not cause you to create antibodies to attack yourself. So autoimmune disorders, they tend to attack different parts of your own body, and there's a myriad of those things. So the vaccine's really good at creating antibodies against specifically a protein on the coronavirus itself. So I usually recommend to patients who have lupus or rheumatoid arthritis or things of that nature to consider the vaccination, because an autoimmune disorder, in a way, can suppress or make your immune system a bit weaker. Sometimes those patients are even on medicines to calm down their immune system. So that could be steroids and other medicines that, in essence, they're trying to calm that immune response down so that those antibodies do not attack themselves. So again, they would probably be higher priority of patients that I would recommend that they get the vaccine.
Thank you, Dr. Lambert. Would anybody else like to comment on that one? Okay, I'll do one more from chat and then we have to go back to our regular questions. I will try to get as many questions from chat as I can. Here's one more. If you have taken a regular flu shot, should you also take the COVID vaccine? Is there a waiting period between shots?
Not that I've heard. I don't know about my co-panelists. So what we definitely don't want is a double whammy. So God forbid you get flu on top of an actual coronavirus infection. If you look at the data, mortality goes way up. There's a much higher chance that you have to be hospitalized or even pass away from a super infection of that type. So I haven't come across any regulations as far as you have to space out a flu shot from the COVID vaccines themselves. So I say whenever they're available to you, you should get them.
Actually, excellent question and answer, Dr. Lambert. I think that some of the recommendations are saying for vaccines in general, you want to wait a couple weeks. If you're trying to mount an immune response, you want to make sure that whatever vaccine you're giving, you have an opportunity to mount an immune response with that vaccine. And then 2 weeks later, if you'd like to get a second or another type of vaccine, then you can do that. That's currently what I've been suggesting to my patient. And I think that some current recommendations are to do just that. Wait a couple weeks after the vaccine.
Thank you, Dr. Alford. The next question is for Dr. Rimbert. Should I have the vaccine if I am pregnant?
Well, that's an excellent question, Catherine. The testing that was done on the vaccines was not specifically tested on women who were pregnant, although there were women in the study or the studies that took place who became pregnant during the studies. As of now, we're recommending that people do get vaccinated, but at the same time, there haven't been any clear studies in particular looking at the vaccine for women who are pregnant. Although, as I mentioned, there were women who were pregnant or became pregnant during those studies.
Would anybody else like to comment?
Yeah, I'd like to add to that. Dr. Rimmer gave an excellent answer to that. You may want to, if you happen to be pregnant, you may want to call your obstetrician gynecologist to see what their recommendation is specifically. But we will have data because people have gotten pregnant after they've received the shot or even while they've received the shot. So we'll do some retrospective studies, I'm sure, to find out how safe it is just from monitoring what happens over these next few months to years. The unfortunate thing is nobody wants to be a part of a study that they didn't enlist in, but just for the fact that we are going to be studying what happens to people when they get these immunizations. So the current recommendation is not to, but definitely you want to call and ask your OB doctor or your family doctor if you're pregnant what they recommend, what they suggest. As always, we as all physicians always refer to the primary doctor that's taking care of that case. So definitely do that, but current recommendations are not to give those vaccines just to pregnant women, just because, and that's the same thing with children, just because we don't know enough about it yet to be able to recommend it.
Thank you, Dr. Alford. The next question is for Dr. Lambert. What happens if the second vaccine in the series is delayed?
That's a good question. So that's something that may have to be asked to the company or the hospital or the clinic that you're working with. That tends to be more of like an infrastructure issue. I know a lot of places they're doing their best to avoid that from happening. So if it's at all possible, when you get your first shot, usually there's some sort of a method or mechanism that's in place to really get you the second shot as close as possible to it, whether it's the 21-day or that 28-day period. So a lot of places are trying to avoid that and being very careful to make sure before you even give out the vaccines that you have enough supply to really meet those sort of demands.
Thank you, Dr. Lambert. Anyone else want to comment? Okay, the next question is for Dr. Alford. If you get infected with COVID-19 after getting vaccinated, will you be protected against the worst symptoms?
Yes, that's the real purpose for getting the vaccine, is to protect you from getting the worst symptoms that you can get. There's nothing saying that you won't get the virus, even though you've been vaccinated. The virus is still out there, and you still have 95% effectiveness. That's not 100%. So 1 out of 20 chances of getting infected still, even though you got the vaccine. So again, I try to keep numbers very simple. So you got a 1 out of 20 chance of still getting the disease, even though you got the vaccine. So the chances are that you will not be as sick when you get the virus, if you happen to get it. You may have very mild symptoms because your body will mount the immune response that it needs to fight it off. So that's why it's so important to get it, and also to still avoid the possibility of getting the virus, because you still can get the disease. It just may be in a lesser form.
Thank you, Dr. Alford. Would anybody else like to comment? Okay, the next question is going to Tony. Will there be any clinical trials in Madison County specifically or anywhere in Illinois?
Trials, not that I'm aware of.
Okay. Would anybody else like to comment on that? Okay. The next one is for Dr. Rembert. Can someone still get COVID-19 after the vaccine? I think we've already answered that.
Yes,
Do
definitely.
you want to reiterate, or should I just give you another question?
I could briefly reiterate, but if you want to give me another question, but yes,
Okay.
you can absolutely get it even after getting the vaccine. Although, as Dr. Alford just mentioned, the chances are far slimmer, 5% chance if the vaccine is 95% effective, and you're likely to have less symptoms if you get it after being vaccinated.
Okay. Dr. Rembert, you've had your first dose of the vaccine and then you get COVID. Should you wait to get the second dose until you're not ill?
That's an excellent question. Typically, once you get that first vaccine, the vaccines are scheduled to be given at a certain time. But if you do come down with the illness, the recommendation, from what I understand, is to hold off on getting that second vaccination. But I'll defer to the other panelists just for a more definitive answer.
Okay. Would anybody else like to comment?
I would actually, we would ask that anyone who has an active diagnosis of COVID, that they complete their 10-day isolation period before they try to get a vaccine. That's from a matter of safety of coming into, obviously the clinic area, you're protecting those individuals that are trying to do the administration. In the same sense, if you are a close contact and you've been quarantined by the local health authority, we ask that you do not come and get the vaccine during those times of quarantine or isolation. Please just wait that amount of time. It's either 10 or 14 days, whichever. But please do not come when you're actively on isolation or quarantine.
Thank you, Tony. The next question is for Dr. Lambert. How were scientists able to develop this vaccine so fast?
That's a great question. So I guess we have to think about, well, what is fast per se? So when I counsel patients, because sometimes they'll think, okay, is this too fast? Is this an act of desperation? The medical community, are we just grasping at straws with this? And that's not quite the case. So I usually tell patients that to remember, this isn't the first type of coronavirus that has hit the scene, that has been studied before. So when COVID-19 kind of came about, researchers weren't just starting from scratch. There's research that had been done, several years ago that they could jump on to kind of help them accelerate the process. So nothing was bypassed. It's just that it was a little bit more accelerated. And then another piece is that, good research tends to go faster if there's a lot of funding behind it. So you'd better believe when there's a world pandemic that's going on, there's a lot of places, there's a lot of scientists, there's a lot of financial backing to really help to get this right. So I think what we've seen is really a combination of combined mind power, combined resources to really help and funnel a concentrated sort of effort towards one virus. So when you have that sort of recipe, you get responses like this. But make no mistake, the two vaccines went through rigorous phase 1, phase 2, and phase 3 trials to make sure that they're actually safe for distributions to the general population.
Thank you, Dr. Lambert. Would anybody else like to comment? Please unmute Dr. Alford's screen. Thank you. No one wants to comment? Okay, the next question is for Dr. Alford. I don't trust the former president or the government to inject chemicals into my body. If the body has a 98.7% chance of fighting this virus, why do I need a vaccine that is only 95% effective?
Actually like that question because it sounds like it makes sense, but it doesn't. The problem is first of all, I didn't trust that particular individual, and thank God he had no hand in actually creating this vaccine. Actually, the person that created or was very, very likely to have really done most of the work in creating this vaccine was a Black woman. So I can trust that. So that's the one thing. The 98.7% chance of fighting the virus, you do. If you get the virus, you have a high chance that I mentioned earlier, of dying. Again, 420,000 chances out of 25 million, if you look at what's going on. I don't think I would take that to Vegas and try to use that to win. If I got a 420,000 chance of losing in my chances at 24 million, I would much rather take the chance of possibly 1 out of 20 million. So that's the numbers to look at, not the effectiveness of the vaccine, but actually the fact that this virus kills people. The vaccine isn't.
Thank you, Dr. Alford. Would anybody else like to comment? Okay, so the next one is for Tony. Will you run out of the vaccine before it's my turn or phase?
No, we will not. Actually, the allocation process has, it's slow initially, but once we get more out, you don't have to worry about there not being a second dose available. You don't have to worry about there not being any vaccine at all for you to get your initial dose. The time is just really, it's taking right now to just get enough in supply so that we are able to meet the demand. Once that happens and it starts rolling out, the allocations will increase. I guess I should explain that a bit. The federal government actually allocates, means they assign a certain number of doses to each state weekly, and then each state, Illinois in this case, turns around and allocates specific numbers of doses to each county. Now that we have entered phase 1B, that allocation will be based on population. So we anticipate seeing, hopefully, increased amounts of weekly allocations that will allow us to start these clinics and run these clinics more frequently so that more people have access to them. Just please keep in mind, today is the first day in the entire state of Illinois that we've been at 1B. So it's just going to take a little bit of time to ramp up. We've been asking everyone to please just have patience and take some time. I realize this is going to take a little bit of time to get it up and rolling, but we have been posturing and preparing for this. And as soon as we get the vaccine in any kind of useful amount, we will absolutely be doing our best to roll this straight out into clinics so that people can have access to them.
Thank you, Tony. Would anybody else like to comment? Okay, I'm going to the chat again. The next question is for Dr. Rembert. Are there medications that you should avoid taking at the time of the administration of the vaccine?
That's an excellent question. At this time, I'm not sure about possible cross-reactivity with particular medications with the vaccines, other than I mentioned polyethylene glycol, but with that, no, and that's only if you have an allergy to that particular medication that there may be a concern about receiving the vaccine. But as of now, I don't think that there's a risk of potential cross-reactivity with the vaccination and particular medications. But as it was stated previously by Dr. Alfred, Dr. Lambert, definitely check with your primary care provider also as you're receiving the vaccine, just to make sure that, you know, if you do have a history of problems with vaccinations or any history of anaphylaxis, that's also taken into consideration as well.
Thank you, Dr. Rembert. Tony, I think this question might be one of yours.
Sure.
Will the county be texting people who registered on the website to alert them when the vaccine is available?
We won't be texting. We will be actually, if they registered, we will be emailing individuals to let them know that they can go to our website to schedule an appointment. But the majority of people, the general public, to get the vaccine will actually go directly to our website to register for an appointment. You'll actually have a drop-down list on this date at this time. I want to sign up to get the vaccine. We have also established, we will have a specific phone number up for individuals that do not have access to internet or are concerned that they'll miss this on website. We actually will have a call center in place to help people who need help to get appointments scheduled. It's really important for the general public to understand that we have to make appointments to get these vaccinations. This is the nature of the beast. We're in the middle of a pandemic, so the last thing we want is large masses of people standing very close together, waiting, you know, for a long time. In this ordered process of the appointments, I'll just talk to the vaccine clinics that we've held a couple so far back with the phase 1A. We've been able to set up literally batches of appointments, 10, 15, 20 appointments given at one time at 10-minute intervals. We administer the vaccine, and the bottleneck, if you will, is really the observation piece. After you've had the vaccine administered, we have to keep you there for at least 15 to 30 minutes to make sure that you don't have any adverse reactions. So I'm very, very pleased with the process. We have done, you know, like I said, 2 weeks of clinics at this point, but we continue to tweak and improve and build our throughput so that when we do have an adequate amount of vaccine, we'll be able to hopefully administer well over 1,000 people a day.
Thank you, Tony. Would anybody else like to comment? Okay, the next question is for Dr. Lambert. Can a person have antibodies that keep them from getting COVID?
That's a good question. I'll probably bounce this to the co-panelists as well. Since this was like a novel coronavirus, with that definition, it tends to be the case that no one originally had antibodies just in store for protecting themselves against that, which is why vaccines have been super important in this case, because when you come into contact with this and you don't have, protection in the first place, that's when infections ensue. So, but again, I haven't come across that, but if my co-panelists have heard of someone just naturally having immunity to it without having the infection itself, I'm all ears.
Would anybody else like to comment? Thank you, Dr. Lambert. Okay, one more question from chat. Is there any study, this is for you, Dr. Alford, is there any study that explains the higher death rate reported for African Americans other than social economics?
Well, there are studies all over and ongoing studies of just the fact that the socioeconomics of being Black causes you to have all kinds of issues. Access to healthcare is actually one of the biggest issues. So if we can correct that access to healthcare problem, if we just corrected that, we would probably see some improvement in what happens in our communities, in the Black communities. And I will defer a lot of that to Dr. Rembert. I know he knows a lot more about that than I can talk about.
Thank you, Dr. Alford. And that's an excellent question. In looking at the data, the CDC has admitted that there are a disproportionate amount of African Americans and people of color affected by the virus. Currently, with the current CDC data, we comprise about 12% of the infections in the United States, but account for almost 16% of the deaths. And the CDC had to admit that because of these disparities, including, as Dr. Alford mentioned, lack of access to healthcare, but even when we get access to healthcare, being discriminated against and looked at adversely in the healthcare system may contribute also to poor outcomes. And that's where cultural sensitivity training, that's where, having physicians who are culturally competent and really connected to the communities they serve really plays a vital role. Because the thing is when you come in and you're telling the physician that you're having these particular symptoms, coronavirus symptoms can mimic illness from other diseases, just as simple as the common cold to pneumonia to sepsis, which is an acute infection throughout the entire body. And the thing is you have to have a provider who's willing to take that time to see what is actually going on with you and be willing to not only listen to their patient, but to treat them appropriately when the diagnosis is there. And that's what we've seen. There was a case of a African-American female physician in Indiana who was documenting her care in the hospital, that she was not being listened to, and she ended up dying from coronavirus, even though she was in the healthcare system and a physician. So that's all the more reason why we're not only advocating for culturally sensitive care, but even for these vaccinations, because with these vaccinations, we at least have a fighting chance to fight off the infection, whereas we are disproportionately affected by this disease.
Thank you, Dr. Rembert. Okay. The next question, Dr. Rembert, is for you. I don't trust Bill Gates, who is interested in population control and to take a vaccine he is advocating for the public to take. Why do I need the vaccine if I've already had the coronavirus?
Well, that's an excellent question, but at the same time, if you're concerned about Bill Gates and the virus and this vaccine, you probably need to be more concerned about the phone you're using, the laptop you have, the credit cards with the chips, because they get more data from that information and from the use of those objects than they do from this particular vaccine. Now, for the reasons we've mentioned up to this point, we're recommending the vaccine because you have a better chance of survival if you get the vaccine. Even if you do contract the coronavirus, you're less likely to die or have as severe symptoms, but also you're less likely to get it. So even if you've already had the virus, we do recommend that you are vaccinated for it to reduce your risk of not only short-term and long-term symptoms, but even reduce your risk of death.
Thank you, Dr. Rembert. Would anybody else like to comment?
I would love to, only because I like the idea of unfortunately, we give too much credit to where credit is not due. Bill Gates did not come up with this vaccine. As I mentioned earlier, the Moderna COVID-19 vaccine was really originated with Dr. Kizzmekia, they call her Kizzy Corbett, who's a Black woman, 35 years old, just an amazing young lady. You have to read up on her. But that will bring some pride to probably 90% of the people, 95% of the people on this call. She's one of the National Institutes of Health leading scientists behind the government search for the vaccine initially. Again, this young lady is only 35 years old, and she, working with Dr. Barney Graham, had actually came up with this vaccine. So get excited about it and encourage other folks that are Black and Brown community, of the Black and Brown community, that this was created by someone that looks like us. It's not Bill Gates that came up with this. He may have gave some money, but the person that came up with it is Dr. Corbett. So please remember that name, Kizzy Corbett. We may be seeing some very wonderful things happening in this young lady's career. I'm pushing for her to get a Nobel Peace Prize.
Thank you, Dr. Alford. The next question is for Dr. Lambert. Will the messenger RNA vaccines change my genes?
Great question. So the long and short of it is no, it will not. So biologically, it is impossible for mRNA to do that. So mRNA is essentially a molecule that literally tells your body how to make proteins. So proteins are really how our bodies on a microscopic level or a cellular level do all the things that they do, whether that's enzymes or repair, a whole lot of things. So really, it's just teaching your body how to make a protein that'll help you to protect yourself through antibodies against the coronavirus. So mRNA does not integrate itself into DNA. It does not take over your genetic makeup. It does none of that. It's absolutely safe. And once the body uses the mRNA, it tends to just goes away. It has no long-term effects whatsoever. So I want to dispel that no, it does not integrate itself. It is unable to do that.
Thank you, Dr. Lambert. Would anybody else like to comment? The next question is for Dr. Alford. What are the long-term effects, if any, of COVID?
Well,
will they go away, and will they go away with the vaccine?
Good. As was mentioned, there's quite a few. It's a long list of possible long-term side effects of the disease. And I actually listed some of them just in preparation. Listen to this list: fatigue, shortness of breath, cough, joint pains, chest pains, muscle pains, headaches, loss of smell or taste, rashes, memory or concentration or sleep problems. We call it the brain fog, hair loss, depression, palpitations, dizziness. Those are some of the things that we talk about when we talk about that long hauler syndrome. We even believe that even coronary artery disease is worsened by this disease, maybe even initiated. Chronic restrictive lung disease. All of these things, because you get the virus that you may think it just was like a flu. All the symptoms I had were like a flu, but you may have chronic long-term side effects due to inflammation, chronic inflammation, which is what this virus causes. So you do not want to get this disease. And that's why, again, I'm very passionate about telling my patients that you don't want those symptoms, even though the symptoms may be mild and they may be short-lived if you get the disease. We don't know all of the things that may happen down the line, years down the line, months or years down the line. We don't know what they are. Again, take your chances with the vaccine, not with the virus.
Thank you, Dr. Alford. Would anybody like to comment?
I absolutely agree. Having a few patients on my panel who are dealing with the long hauler syndrome, it's such a heartbreak. It's tough being a doctor sometimes, and you really can't tell your patients how this will fully play out. And perhaps it's even more heartbreaking knowing that this may have been prevented if there was a vaccine in place and our patients take it. So absolutely, even if you don't end up in a hospital, I would hate for anyone to have to deal with all these generalized and just vague symptoms that really can make a patient feel miserable, even if they're just not in the hospital. Literally the functionality of your life and the quality of your life can be greatly changed because of this virus that we may think doesn't do a whole lot.
Thank you, Dr. Lambert. Tony, the next one is for you. Can I pick what vaccine, either Moderna or Pfizer, I want to be vaccinated with? Do I have to get vaccinated, and can my employer require me to do so?
Number one, it is not a requirement to receive the vaccine. That is a choice. Can an employer require it? I suppose that an employer could try to do that, and I suspect that is, it's just frankly not been determined at this point as far as what employee policies, if they actually supersede, but this is not a required or a mandated vaccine. The first question you asked was, do I get to pick the brand of vaccine I want? And unfortunately, that answer is no. My recommendation would be is to get the vaccine when you have access and it's available and you have an opportunity to get it. The allocation again is very limited. For example, the first couple of doses we received allocations we received were Pfizer, but we have now, we've pretty much exclusively down to Moderna. We will anticipate additional vaccines coming on board. So at some point there may be, other options, et cetera, but you really need to not wait. You need to get the vaccine when you can get the vaccine. And for the most part, both are working, as they are intended to work. A little bit of difference as far as when you go back to get your second dose, but for the most part, the logistics of how we handle the vaccine and distribute it, that's what's the most important part for us, the people that are putting it in your arms. Your goal is just to get the vaccine when it becomes available and you're able to.
Thank you, Tony. Would anybody else like to comment?
I would like to comment on that. I'm not absolutely certain, but I'm pretty certain that there will be some businesses, and if it were my business, I would require that everyone get the vaccine before they are allowed to work. That would be my requirement as a small business owner. And I can tell you that there are a number of small business owners that want to keep their business open, and they don't want people to be off sick because they didn't get the vaccine. Right now, we do have hospitals that require us to get flu shots. And many times people can't work unless they're working with PPE, unless they got a vaccine, the flu vaccine. So I can foresee that is going to be possibly a requirement. It may even be a requirement to get on an airplane, to get either the vaccine or show proof that you are negative for the disease. Already, we're telling people that in order to fly to certain countries, you have to proof of getting a test, and they're actually administering the test before you get on, and sometimes even before you get off into another country. So I would suggest that, and this is again me talking to my patients, I suggest that everyone get the vaccine so that you don't have to be limited, and your life won't be limited by someone or some entity saying you can't come here because we don't know if you have protection from this disease. So there may even be restaurants that say, I'm not sure if I want you to come in my restaurant if I'm not, I don't want you infecting my people that work here or the people that are dining next to you. We don't know if that's going to happen, but I kind of have a suspicion that some may consider doing that. So to protect yourself from it, get the vaccine.
Thank you, Dr. Alford. This one is for Dr. Rembert. Can you contract COVID if you are wearing a mask, but people around you are not? How do people who take precautions such as masking, social distancing, and hand washing still contract COVID?
That's a Excellent question. And yes, you can still contract the virus, even though you are practicing social distancing, wearing PPE, washing your hands, and doing everything that is being asked at this point, because the virus, and this particular virus, is very contagious, very virulent. Those steps that we just mentioned can reduce your risk of contracting the virus, but at the same time, you can still be susceptible to it, especially if you're around people who choose not to wear their masks, choose not to socially distance, choose not to wash their hands, choose not to do all these things that we're recommending, because all of those things, when not being done, can increase your risk.
Thank you, Dr. Rembert. Would anybody else like to comment? Okay. I have Dr. Forte, I believe that's his name. He left a comment in the chat. It says, excellent presentation. Could any of the panelists please comment on the role of lifestyle, mindfulness, and meditation during this time of the pandemic?
Yeah, I can touch on that. So yeah, I think there's a whole other topic of COVID fatigue that we talk to a lot of our patients about. So not just like the physical elements of it, but also like the psychosocial and emotional aspect that people are tired. People are feeling burnt out, including physicians. Sometimes we feel a little battle worn ourselves, and it's, there's a whole other discussion about how do you preserve yourself? How do you keep yourself going? And I think probably one of the first things you need to do is to be aware of when you're kind of slipping into that sort of COVID fatigue. So that could be, getting a lot of sleep, but you still feel drained, or you feel like the quality of your work may be suffering, or you might have an increased sense of isolation from the people that you love or you work with, depressed mood, increased irritability, anxiety, things of that nature. You can talk to your doctors about that stuff too. We care also about those things very deeply. And a lot of us, we have resources that we can provide to you. Some of this can be done through seeing a psychologist, but even mindfulness and lifestyle play a huge part in this. So even with infections, how you eat and how you take care of your body, many of those things can help to boost your immune system. So a lot of those things, that the risk factors for COVID that unfortunately do hit Black and brown communities, a lot of it can be tied to lifestyle. So how we eat. So when you think about, staying away from fried foods, having a whole grain diet or even a plant-based diet and things of that nature, that can really help a long way as far as your physical health and even just how you feel. Having proper sleep, and then even having structure in your day. I get frustrated because, in this pandemic, some of us may be working from home. You may have kids who are doing school at home, where a lot of things have become blurred. So I've encouraged patients, just for their own mental health, try to create rhythms in your day wherever you can. So that might be putting simple things on your calendar, like, okay, at this time I will eat breakfast. At this time I will exercise. At this time I will meditate. So creating times and spaces that are regular for you to provide structure can really help you to gain a sense of control. It's like, what are some things that I can control right now? There's a lot of things in the world that I can't control. I can't control the actions of others, but there's still some things that I can do for myself that, again, can really anchor you. And then when you think about mindfulness, that's really just, in essence, just being in the moment. A lot of times we are so worried about what has happened and about what's coming up that we don't appreciate the here and now. So mindfulness is really, again, creating rhythms and times where you can, do deep breathing exercises, or you can do meditation, you can draw, you can journal. There's a lot of ways that you can do that. There's apps on your phone that you can download for free that'll guide you through these things that really, again, help to anchor you. So I'm a huge proponent of that. It could be mindfulness, meditation, prayer, finding community. So some people, especially over the holidays, have been finding novel and creative ways to stay connected to people, because, again, I think that helps to push away all those negative emotions that come from just being in the middle of a pandemic. So just remember that, we may feel like we're done with COVID, but COVID is not at all done with us. So we need to make sure that, we preserve ourselves in all aspects of life.
Thank you, Dr. Lambert. We've exhausted our time. I want to give each one of the panelists maybe 1 minute to give final remarks, and then I want to turn it back over to the president of the NAACP, Walter Williams. So we can start with Dr. Rembert, and you can give final remarks if you'd like, and then we'll go with Dr. Lambert and then Dr. Alford, and then Tony Corona.
Thank you, Catherine. First of all, I want to thank all the panelists, Dr. Alford, Dr. Lambert, Ms. Corona. Excellent job, excellent recommendations. But most of all, I want to thank each of you who were able to participate this evening. Each of us are sharing part of our experience and medical knowledge and acumen with you because we have a genuine desire to make sure that our communities are cared for. And in the midst of all of this, we've seen that, you know, there's been an isolation. And I mean, this isolation is prescribed. We're told to separate from each other. We're told to socially distance from each other. So the comments that Dr. Lambert just made about finding ways of connecting are especially necessary. But even in the midst of all of this, we're advocating for this vaccination for the simple fact that we want to see people live and live their best lives possible because we've lost so many people because of this virus. Over 400,000 people have died and more are dying each day. Literally thousands of people around the world are dying every day. And we want to make sure that that stops. So we're doing our best in sharing this information and sharing what we shared with you this evening to hopefully mitigate that, and hopefully that in us sharing it with you, you can share it with someone else as well. So thank you for your time and attention this evening.
Dr. Lambert?
Oh, sure. So not much else to say. It's just a pleasure to be here. I guess my main message would be just to remain hopeful. I think this is one of the first times that we're seeing as a medical community like a glimpse of hope. So please maintain that hope that I think brighter days are coming. But we are going to have to think about each other. Like, what can I do to help my fellow man or woman? And I think getting your vaccine is one of the realest forms of doing that at this moment. The science behind it is highly informed and trustworthy. Hopefully what we've been sharing has helped to dispel rumors or misinformation and really helped everyone who's listening to, one, make an informed decision, and secondly, spread that to other people who may not have been here who wanted to be here. So I'd say thank you for your time and keep the faith.
Dr. Alford?
I do want to echo my fellow panelists. Thank you to the other panelists. You guys did an excellent job of doing what we needed to have done, and that is getting the information out to everyone. Catherine Carter, I do want to personally thank you for putting this together and making sure this happened. I really have to take a bow to you. This is a wonderful opportunity for us as physicians and healthcare workers to really get this information out. My only last thing to say is, you know, and unfortunately, I do have to give a shout out to President Trump. As much as I don't like to, he put together Operation Warp Speed, which allowed this vaccine to be produced faster than normally that we would see with the vaccine. It took 4 years to develop a mumps vaccine. And many years after it, now we have a vaccine in 6 months that's effective. I want to thank those individuals, those 77,000 initial individuals that were brave enough to say, give me this in my arm. I don't know what this is. I'm not sure it's going to work. I do want to thank those people for having, you know, volunteered to be those first people for me to give the example that, you see, 77,000 people decided to take the chance in order to help us all. So I do want to give a shout out to those folks. And again, as was mentioned, I do want to thank you all for being on this call. There were a great number of you on the call. I think the total, I got up to about 80. Very excited that people really want to know about this. I'm so glad that you all had an opportunity to hear from these individuals, my colleagues, because we have to get the word out. Now it's up to you to not only just get the vaccine yourself, but as leaders in your community, and all of you on this call are leaders in your community, it is your responsibility to get the word out. This information that you've been given, there's a number of folks that need this same information. They may not be able to have it in such a compact form that you were able to get today. A lot of information, but we poured out to you so that you can pour out to others. We have to get our communities vaccinated as soon as possible because we all want to get away from wearing masks. We all want to get away from physically distancing. I don't use the term socially distancing, from physically distancing ourselves. We all want to get back to outdoor activities and indoor activities, getting together with our families. I have grandchildren that I need to see on a regular basis. You know, we need to do that, to get rid of those masks, to get rid of all of the restrictions in our lives. This vaccine is the way out. It's the way to do it. So I encourage you all, again, I say I'm very passionate about it. My sister-in-law died from this disease. So, and only 52 years old. So I am very passionate about this for so many reasons. I've had many patients also that died from this. I don't want to see that continue to happen. So again, I encourage you all. I thank you for getting on. Thank you for taking on this information. Thank you to the NAACP of Madison County. You guys did a wonderful job of putting this all together. I am so excited to have this opportunity. Thank you, thank you, thank you.
Tony Corona.
Sure. I just really briefly want to also thank you for allowing me to be part of this. This is really a humbling experience to be surrounded with such expertise in science. And I truly appreciate your words and your peek into this and encouragement for people to become vaccinated. I just ask for our listeners to please have patience with us. We have been pretty much headstrong in responding to this pandemic now over a year, and we will continue. So for us, our process is not just vaccine distribution and administration. We still are following up on cases and contact tracing, and we still have plenty of community testing sites available for people. Please don't let your guard down. Please watch our website, madisonchd.org, for information. Explore also coronavirus.illinois.gov for vaccine location finders. I promise you the additional sites are just going to be rolling out and trickling out over the course of the next several weeks. It is coming. Almost 10,000 vaccines have been received and given in Madison County thus far. We've got nowhere to go except more and more and more. So I just ask for your patience, and I thank you in advance for your cooperation. We are as excited to get this vaccine in your arms as you are. And so again, just please understand that we're working around the clock to make that happen. And thank you again.
Excellent job, panelists. I'm going to turn it over to the president of the Edwardsville branch NAACP, Mr. Walter Williams. Thank you so much, Walter.
Thank you, Catherine. I appreciate all your work and effort involved in this project. And doctors and Tony, thank you for your time and your passion to address this health crisis in the African-American communities. Next steps. I will forward emails that we receive for the branch to your personal email, anything that may be pertinent to this. In addition, the Edwardsville NAACP will be putting up a resource page on the website. You will find this under resources on our website. If you had a question that was not answered, it will be posted there with an answer so that everyone can see the question and see the answer attributed to that question. So again, we're going to do our part. We ask that you do your part. You started that by tuning in to this town hall, which we are very appreciative of. This is the first step to answering your questions, eliminating any anxieties, because in order for our community to recover, we must be vaccinated. Again, thank you. Thank you to all the panelists. Thank you to all the attendees. This concludes our presentation today. Thank you. Have a safe evening. God bless.
Thank you, everyone.